Welcome, everybody. If you can wait a couple minutes while others join, we're going to get started promptly at 12:02. Thank you for joining us. Whether you are watching it live right now or you're going to watch a recording later on, thank you for attending and watching this important, insightful session with these two ladies. We will get started in 1 minute. Okay, I'm going to get this started. Welcome for those that are watching live, and also for those that are going to watch the recorded version of this important webinar. We have two experts in the employee experience area of a healthcare practice or healthcare system, and we have an expert in the patient interaction platform area of the health system and healthcare practice. I heard somebody say yesterday that they felt like healthcare is about 10 years behind with employee collaboration tools and also patient interaction tools. And I'm hoping that what we do here at KANO Associates over the next coming months helps you prepare for 2024. So can we go to the agenda that I can review with everybody? So Aimee, who has recruited and hired and supported healthcare workers in the Ohio marketplace for many years now, a lot of conversations, probably thousands of conversations. So she knows intimately what people are looking for and also why they leave their employment. And then Patty Hayward, an expert in the healthcare field, been in the healthcare industry, and now works at Talkdesk, one of the recently announced Gartner Quadrant leaders for patient interaction platforms. So she's going to cover what Talkdesk is doing to address these two specific challenges that are causing attrition and maybe causing patients to seek another healthcare provider. And then I will come back at the end and I will recap it and next steps, and we'll open it up for your questions. So without further ado, I would like to introduce Aimee Houde from KANO Associates to present a couple slides on the employee experience challenges in healthcare.
Thanks, Kevin. I'm always happy to talk about getting talent into healthcare, and more importantly, in 2023, retaining talent and all about anything related to employee experience. So as I was thinking about beginning this today, I thought, well, most of the folks on this call read Becker's every day and see stories about the importance of employee engagement, employee experience, retention, all these issues that are marched out on a day-to-day basis and are so important. So I just thought we'd confirm the elephant in the room that certainly there is a talent crisis in healthcare. And I just wanted to touch on, for the first time in 15 years, it's the #1 concern for CEOs and healthcare around the country. It's obviously not only a concern for CEOs, but affects the frontline worker in healthcare. It doesn't matter if it's a nurse, someone in scheduling, someone in revenue cycle. The fact that staffing and recruiting, retention, employee experience right now are at critical levels and don't appear to be getting better over the next couple of years, it really is causing a lot of stress on the frontline worker, regardless of where they are in the food chain in healthcare. So it's one of the key drivers why healthcare workers, your staff, is feeling completely burnt out, stretched thin. They're being asked to do more with less. There are fewer people to do it. So it's certainly a big issue right now. Certainly there's the human toll, the morale, and the human stress, or the stress that it puts on your staff. But the actual cost, the indirect and direct cost to your organization is absolutely huge. And it's something that I think often surprises healthcare leaders every time I bring it up. Every time you lose someone on your team, when you go to backfill them, it costs your organization 1 to 1.5 times that person's annual salary. By the time you recruit them, bring them on board, bring them up to productivity, it is an enormous cost. We can go to the next slide. So I just wanted to focus on what I hear on a daily basis and weekly basis. I hear from folks in healthcare who I've placed before, and I get the primal scream from them saying, please find me a new job. So I'm intimately knowledgeable in terms of what folks are wanting right now in healthcare and what they need. And some of these we know, but we want to dive into what we can actually do, what the strategies are to address them. So first trend is being valued. I often hear from healthcare workers that you can't pay me enough to stay here. And that's absolutely true. Most of what healthcare workers want right now is some flexibility in where, how, and when they do their work. Now, for clinicians, the where they do their work, particularly if they're in a clinic or face-to-face patient care, the where they work, but the work that they do and how they get it done is definitely something that organizations can change and need to recognize. One other thing that's happening in the trend or in that space is giving employees soft benefits that they actually want. So instead of more PTO, offer them potentially some PVO, which is paid volunteer time, which is a big trend right now. Another trend is wellness and well-being. It's essentially how well are you taking care of your employees. There are new metrics out in the marketplace. Indeed and Glassdoor just came out with a big initiative. And Indeed and Glassdoor is the first place where new talent, when they're looking to join your organization, goes to see what kind of employer you are, whether you're employer of choice. And oftentimes people won't join your organization if you have anything less than a 3 or a 3.5. Now there's new metrics that measure happiness, satisfaction, stress, and purpose. And stress and purpose are 2 points that I hear, 2 observations and complaints that I hear from people in healthcare very, very often. The driver there is an observation around, hey, the reason I got into healthcare, meaning the direct care of patients or helping people or guiding the patient journey, is no longer there. I'm stuck doing other things that can be leveraged to other people, or I'm stuck doing things that take away from that direct patient care and guiding that journey. So that's definitely a trend that is so important to pay attention to. Another trend is being heard, but that's something that we'll wrap around to at the end. And that's another, it's kind of a sub-trend of being valued. A lot of employees right now don't feel that their employer listens to them, gets their feedback, really takes into consideration their ideas. And who better than the people on the front lines than those folks to tell you what's needed to improve the employee experience, improve their day-to-day work, but also improve patient care. So with that, I'll turn it over to Patty.
Great. Thanks, Aimee. Some great points about, just what we're seeing in the market today. We've done a lot of research as well, just to understand what's happening in the market. There's a lot of trends that are also converging on top of just the burnout and the feelings that we're seeing from our employees. So on top of that, there's this big piece of thing happening where expectations have really risen around what patients expect to see when it comes to their care and communication with them. So, they're really expecting a much more digital engagement. They're expecting more personalized engagement. They're expecting a lot of different types of engagements than healthcare has been used to. Healthcare's always been really focused around the physician and how do we make sure we attract and retain the best talent there, and really thinking about care. And so obviously we want all of those things to continue, but and navigating healthcare is very hard and very complex for the ordinary person. And so this is becoming a really big trend that we're seeing, and people are exercising that with their feet. They're going to organizations where they are feeling like they get the experience that they get from other verticals. They want choice. They want to be able to communicate the way they want to communicate on the channel that they want to communicate with. They want to have the digital channel and the ability to see, information. They want to be able to communicate that way. They want to do automation in digital channels as well. So there's a lot of pressure going on from that perspective. I think the other thing that's really interesting to think about is when you think of technology, in most other verticals, technology actually helps simplify interactions and simplify that journey. In healthcare, that's not necessarily the case. We have a lot of new technology coming into healthcare, whether it's genomics that's really helping us with targeted medications, whether it's the types of modalities that we use in order to diagnose different types of things. There's the electronic health record. There's a lot of different technologies that have come into play, and it's actually increased the complexity of healthcare. And that's, again, continuing to be harder and harder to navigate for sort of the ordinary person. So I think we're seeing a very different kind of thing when it comes to technology and what it gives. So, that also, again, talking about your piece that you talked about earlier, is just, this is now just pushing down on our employees and making this burden a lot harder for them. So you think about doctors, nurses, and the non-clinical staff that are out there and just, talking about this overwork, this overburden that they're feeling. And we're also seeing just a lot more anger and violence in the workplace towards these people as well. So it's very difficult as a person working in healthcare right now. Aimee, you hear about this all the time, people calling you, and I have a lot of friends in obviously in healthcare who I personally speak to about a lot of these, and this is just, it's a looming crisis. So, I think it's a really big thing to think about as we're looking forward. And on top of that, we talked about just, people really comparing your organization, not just to other healthcare organizations, because that's actually not the first thing that comes to mind. They're thinking about other types of verticals and other places that they interact and wondering why they can't get similar interactions in healthcare. The technology exists. So I think this is something that's really there. So what's happened? Absolutely, healthcare recognizes this. Absolutely, healthcare is trying to change it, and they're trying to evolve. And during the pandemic, what we really saw was our ability to quickly adopt new technology, which was actually kind of nice, because typically I think we've always thought of healthcare as really, really slow to adopt new technologies, et cetera. But because of that crisis, we actually put in new technologies very rapidly because we had to, in order to deal with what was happening and the remoteness of what was going on. We were able to adopt technology really quickly. What happened as a side effect of that is we adopted a lot of point solutions that didn't necessarily integrate well. It was just, what could I do? It was fast. It was easy. We could get things in. We didn't necessarily do a lot of process changes. We slammed a lot of things in order to really deal with what was going on. So now a lot of organizations are really going back and saying, okay, long term, how am I going to do a lot of these things? I need to have a lot more synergy between my different pieces of technology. My tech stack needs to be more integrated, and it needs to grow with my organization. I'll give you an example. I had an interaction with a physician. I needed to go to a specialist. So my primary care doc sent me to a specialist. I called that specialist every day for a week and got voicemail only. I never got a human. I got basically voicemail with, hey, leave me all of this information. And it was a lot of information, which, not really a secure channel to leave it on, but I did. And what ended up happening was I never got a call back. About a week later, I got a text message from them saying, hey, we received your referral. You should call us. And you can imagine my frustration because I had been calling them for a week. So my first thought is, well, let me just see if I can interact via text, because I had gone to their website where they said that you could do appointments and you could interact with them. Once you couldn't, all it did was lead me back to a phone number. So I said, well, let me see if text messaging works. And of course it didn't. I got an error message. And so it made me think, let me investigate, who is this technology from? Turned out it was from a revenue cycle vendor who had probably pitched this idea of, we can actually help you curb leakage, because I'm sure this practice was undergoing a ton of leakage. They got a lot of referrals that just never came into the office and turned into patients. The issue isn't because of, the fact that they weren't getting enough referrals, but, having a text message piece that doesn't go anywhere doesn't really help them, especially when they don't have enough staff in order to physically interact with all of these patients. Aimee, I'm sure you've heard from folks that have called you. What's been your feedback from some of our, your colleagues as they've called in to talk about just their frustration with some of,
Well, it goes back to your point about wanting the same level of let me communicate the way I want to that they experience in other industries. I mean, your example of having to call and leave a message and text, and then to have them come back and say, we don't know who you are, and we have no record of you or interacting with us whatsoever. It doesn't have to be that way. It doesn't have to be this difficult. And to your point about a knee-jerk reaction to, not a knee-jerk reaction, but what in the moment seems like a good answer to an issue, like a revenue cycle, like backfilling open or canceled appointments. This is something we hear in revenue cycle all the time, where they just want a quick solution at the scheduling point, because everyone knows that's the start of revenue cycle, to backfill those open positions. And they go ahead and they get a solution that solves just that problem, but creates a hornet's nest of other issues because they haven't gone at it holistically, or kind of played whack-a-mole, for lack of a better description.
Absolutely. Unintended consequences of trying to put in new technology to solve a problem. We see it a lot.
Right.
So, I thought about it, thinking about, I had to call Delta the other day, and I will tell you, the interaction I had with them was very delightful. I didn't even actually speak to a person. I spoke to a virtual agent, and they were able to solve all of my problems that I was having with a reschedule of a flight and all sorts of different things, just completely with a virtual agent. So I didn't have to wait. I didn't have to be on hold. I was able to solve everything. They knew who I was the minute I called. They actually answered, good morning, Patty. Is there, what we see you're traveling with us this afternoon. Is there something we can do to help you?
That's great.
It was quite a delightful journey. They had all my information. They had intent on, okay, she's probably calling because she's got a flight coming up here this afternoon. We see it's delayed. What do we need to do here to help this passenger? And it made me think, why is it so different in other industries? We talked about the complexity. That's obviously a huge piece of it. There's a lot of regulations that the airlines don't have. So we know there's that. But the other thing that really hit me was the central tenet for these guys is the consumer, right? They put the consumer in the middle, and that is their entire goal, is to make sure you have a delightful journey. That's simply their tenet. When you think about that, and then you think about the healthcare industry, our central tenet is quality care.
Right.
We want that to be, by the way, our central tenet. I don't think anyone argues with that. So the actual journeys that we've been mapping is how do we make sure these people get the most quality care? It's not about how do we make it as frictionless as possible? How do we make it delightful? You know, is there any of those things? I don't even think those words come out, right? You don't think about a delightful journey through healthcare typically ever. So your goal is, I want to make sure I get the best quality care. So that's a fundamental difference that we see, I think, between these types of organizations, and we should acknowledge and embrace that. But there are a lot of things that we can do in order to make sure that we can still honor that central tenet of quality care, make sure that we're thinking about all of this, the risks and the privacy and all of the different regulations that we have to deal with. But there's still some things that we can do to move this journey forward. The three tenets that I really think about, and when I think about interactions I've had in healthcare that have made a huge difference, first is that personalization, right? So I always joke about every time I call my primary care doc, who I've been with for over 20 years, when I talk to their contact center, it's like I'm brand new. They don't know who I am. They don't know who my primary care doc is. They don't really ever invest in giving me that feeling of I'm known, right? Now,
Right.
contrast that when I go into my physician, she does a wonderful job of it. She's one of the reasons I go to her. She's always got, a remembrance of our last conversation and brings things up and makes a point of making sure she knows I feel known to her. And that's why I keep going back. It's certainly not the interaction with the folks scheduling the appointment and things like that. But think about how easy that would be to sort of bring that forward and help our folks that are answering the phones to sort of bring that type of personalization forward. So that's really important, because we all want to feel like someone understands that we've been with them for a long time. They know the issues we've had. They know the journey that we're on. That makes a huge difference in trust. It makes a huge difference in just wanting to continue to patronize that particular institution. The other thing I think that's really important is not having to repeat yourself constantly. We've all gone through it, right? Every time you talk to a new person in healthcare, you actually have to retell your story.
Right.
And if you're sick, or if you're, caring for an elderly parent or a child that's sick, the trauma of having to tell that story over and over again is really difficult. So synchronizing those discussions across the different channels is really important, so that I understand that you need to make sure that you're validating that you're talking to the right person. But once you do that, you should be able to open up all the information and know what the conversations were, so that they can, hey, I see that you were just talking to so-and-so, and here's the questions that you had. Let me help you with that. That goes a long way. It also brings down that sort of stress, that anxiety, that anger that some people might be feeling, so that interaction is more pleasant for the employee too, because people get into healthcare, like you said, for purpose. They're coming to healthcare because they want to help people. So allowing that and bringing that information up to them is really important. And on top of that, what can we just take off their plate altogether? Those
Right.
poor employees, right? What can we do that sort of drives people to digital channels so that they can interact in a way that allows them to schedule, reschedule, get, do their prescription refills, pay their bills, all of these different things that we've seen. And then not only that from the digital perspective, but there's still going to be people that just call. So how do we provide them with a voice virtual agent that can take care of all those things in a nice, empathetic way, and not in this sort of old fashioned way where all you're doing is yelling, agent, 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 so you can get out of horrible cycle of talking to those old fashioned voice bots. Those are all really, really important, so that we can make sure that we're reducing the amount of stress on these poor employees that are answering the phones, and that by these patients will have to wait 20 minutes to get on with them. They're already angry by the time they get on with them and frustrated.
Right.
Bring all that tension down.
This just empowers the employee to do their highest and best work, and work that they're excited to do. And they really just want to help the patient. And if they get to do that, and patients are able to be served in another way, more quickly, more efficiently on some of those lower level things, it really empowers the employee to, feel great about the work that they do. And that's important as well.
Right. It gives them the time to add the empathy, to do
Yes.
the reading, to say, okay, I see what you've been going through. Let me
Right.
help with that. Those are really, really important aspects as we go forward. And I think we're going to enter a new era here, Aimee, with generative AI really being such a major driver of a lot of this information being really right at the fingertips. Because you think about it, you're used to just a wall. If you are provided the information, it's a wall of information, and you've got to read it. And you've got to do that while you're trying to talk to the person. That's really, really difficult. So you need to provide information that's consumable in a small pieces as it's needed. So they're not having to search things. I've literally sat with agents because, I want to know what their journey looks like.
Yep.
And I've seen anything from sticky notes all over the outside of the computer screen to 100 Google tabs open in the back so that they can go to all the different specialized things that they need in order to have the information for some of these complex journeys. When these are not normal contact center agents where you're just, customer service. These are agents that have to understand a highly complex organization. And how do I help these people navigate through that highly complex organization, which means there's a lot of information they need to get. And it differs depending on which part of the organization they're going to. So being able to present that information in real time to them, what a game changer. That's such a big difference from what I think they're used to today. The other things that are really interesting is, how can we help them with things like responses if they're doing a chat and a phone call. You're splitting kind of some of your time. There's some things that they can do today with generative AI that will actually help them just generate a response without having to really think through everything. And it can add empathy to it. It can add a more level of professionalism, take some of the stress off of having to really think through multiple conversations at the same time, because that's kind of the reality of the new contact center, is that if we're going to ask people to have multiple channels, that means they're going to have to handle multiple conversations likely at the same time. Some that are asynchronous, some that are, in real time where they're speaking with folks, but that's the expectation. So we need to really arm these folks with a lot more tools to be able to do this so that it's not feeling like they're not paying attention, because we all know multitasking doesn't work. If you're multitasking, that means you're not paying attention to anything. And so that's why it's important to me to give them tools that will allow them to help with things like this. And the other thing I think that's coming out that's here today that we can use is things like call summarization, right? You're at this point now where, we do take real-time transcripts. So we can actually summarize everything that is being said, set dispositions, things like that, so that they don't have to spend the time taking notes. I've sat with organizations where they give them an 8-second wrap-up time between calls. Like, that's not possible unless you're taking notes the entire time. And if you're taking notes the entire time, everybody's different at their note-taking ability. So you're going to have high variability across your agents on what you get. You're also going to get, not complete attention to what's happening because you're taking notes. I know I'm a terrible note taker because I like to really listen. So that means I'm either going to have terrible notes, or I'm not going to be paying attention to the person and all the things that they're saying, because I'm going to be worried if I said the right thing and is the grammar right?
This captures exactly what's happening.
Exactly. So being able to actually have that set for you and then just submit that to whatever system of records you need, whether it's just within, your contact center, if you're going back into the EMR and you want to set that information in, or CRM. Those are all very important things that we need to be able to do, because again, we talked about that, people being known and what actually happened previously. Imagine being able to have all of this in that record. Some really great things coming out that's really going to help people feel like they're in a good position to do the things that they want to do. We don't have enough people. This is not a matter of we're going to take over and, people aren't going to be there. They're going to be able to do what they need to do with the employees that they have today. And that's been a real challenge for I don't think I've talked to anybody who's looking to cut a bunch of staff. What they're doing is looking to be able to handle call volumes that they have currently, and not do things like, hey, we're going to put you into voicemail for a week straight because we can't answer questions. So that's really happening. I think the other thing that's really important is integrations. You can't be known unless you're integrating in with that system of record. And in healthcare, that's the EHR. So being able to actually invoke functions inside of that EHR, because that's where you're doing things like appointment scheduling and paying bills and different things like that. You need to be able to actually have real-time integration into those records and being able to actually do things, pull up the information for them, different things like that. Those are all really, really important aspects. And that's something that Talkdesk does really, really well. So I think that's an important thing as you think about just how do we make all of these systems work together? This one's crucial. Have you had any interactions with folks as they're kind of looking forward and figuring out what they want to do, that you're seeing that this is an important aspect?
Oh, it's absolutely critical. You know, EHRs and EMRs are, regardless of the healthcare organization, are kind of the single point of truth, and you have to, but you do have to integrate all the other important business apps, so that it all works together for sure. Yeah, it's absolutely a topic of conversation.
Absolutely. So, conversation's been great. I think there's just, things to kind of think about, and just as we're wrapping up our conversation here, complexity in healthcare is rising. It's not going down. I think that we're going to continue to get more and more technology. We're going to get some great scientific advancements. We're going to get a lot of new things that people have to deal with, because what happens is, as we get those new advancements, then new processes to make sure that we're utilizing them correctly come down the pike to the non-clinical folks. And that's going to be really important to be able to consume. And how do we then deal with that and help these patients navigate those things? Because we're actually compressing and looking at smaller groups of people when you think about therapies and things like that. So that means there's more discussions around, do you qualify? Are you in this group? Here's the information we need to do to make sure that you're going to the right place. So that's going up, and that's making people crazy. You've got, the AI piece that's coming in, which I think really is just going to be a great opportunity. It's such a reprieve. I think it's going to really get us to a great place. And, again, I think we don't have enough self-service, and we don't have enough self-service off of just the patient portal. A lot of people, don't find that a very easy way to interact. And it's very asynchronous, and they want something that's going to allow them to have more real-time connection and discussion. So there's a lot of different types of things that we need to think about as you're thinking about, that digital front door. All right, Kevin.
Well, thank you both. I've been through a few of these over the past few months, and also preparing for more of these going forward. And every time I learn a ton more about this situation with the healthcare worker experience and the patient experience. So I want to share some of my vast experience with technology change and business change and supply chain operations change through both software and communications for many years. They both talked about the frontline workers being heard and giving them the opportunity to provide input. That is a must-have. And I think the conversation for any healthcare practice should be with HR at the head of the table, talking about the attrition problem, setting the operational leaders in the room, all of them at the same time, and say, we have attrition issues in operations. What do you think the causes are? They're probably all going to be different. The common things are going to be the workflow and the burden that are the stressors with their technology and tools, because Patty mentioned they're doing a lot of these things point solutions. And I will say to you, they're doing the application development of all of the different software tools as a separate team, and they're doing the communications automation. And oftentimes they don't even have their channels of communications with patients unified onto one platform, which is something that companies like Talkdesk can do. So I think that's huge. And then the other one that I hear over and over again is, wow, this analytics, how do we capture more revenue, and patient surveys and all those other things. But if you don't have your apps unified, you don't have your workers efficient in their workflow, and you don't have the communications automation of SMS, phone, all of those different communication channels, all unified so that you can capture 100% of the conversations, your data is always going to be, somebody's going to be skeptical about what the data is in an organization. So if you do these things, you're going to get to that better point of data analytics in your healthcare practice. And that's why it's going to capture more revenue, because you're going to retain and add patients, because you're going to be easy to do business with. And at the same time, you're going to reduce your costs, because you're not going to have the attrition problem that you have today, which is sizable in most healthcare organizations. So that's why I like to talk total economic impact. I'll give everybody a little tip. You can go into ChatGPT and ask for a healthcare transformation. Is ROI the best financial calculation, or is it total economic impact with employee experience and patient experience included? It's going to come back and tell you total economic impact is much more holistic and robust, and you need to be thinking about it. And I hear over and over again, we're going to do an ROI on that. I said, are you doing ROI, or are you capturing attrition? Are you capturing new patients? What are you capturing in making these software and communications decisions? And 9 times out of 10, they're not doing that. So that's a big first step to get the right people in the conversation. KANO can help you prepare to do that and have start it the right way with the right people. I also find that people start it, they do it the wrong way, and they get shut down, and the status quo and the silos prevail. And we don't want that to happen. So let's go on to the final page. So if you want some help from KANO Associates and for us to bring you companies like Talkdesk, engage us with this QR code, and that's going to go right to you scheduling a brief meeting with Aimee Houde from KANO Associates. And we're hopeful that we're going to drive this through the employee experience, which she's an expert in. So if you want to engage, please take advantage of this offer that you can have a meeting with Aimee, and we'll move forward. So again, both of you, thank you for all your time and effort putting the presentation together. Very insightful. We're going to make this recording available and also on demand, and hopefully people will start to figure out that there's a different way to go about the future. So with that, if anybody that's on this live has any questions, they can throw it in the chat, and one of us will answer that. Okay, clearly, Aimee, you hit the mark, and somebody wants to know what strategies work now for improving employee retention, or what are your favorite ones?
Oh boy, my favorite ones. I would say, going back to what healthcare employees want now, I hear quite a lot that employees want to be heard, and they don't feel as if they are being heard, or there's some mechanism to do that. So I guess from an HR perspective, from the old HR crone that I am, I would say have a listening strategy for your employees. And I would say that has to be frequent, ongoing. It has to be transparent. You can't rely on the annual employee net promoter score survey or the weekly meeting around patient care to gather some of that information. It really has to be a concerted effort to involve employees in that discussion. And you not only have to ask people their opinion, but you have to show what you're doing with it. Again, the frontline workers, whether they're non-clinical or clinical, they're going to have information about what the patient needs and how their workflows could be better. And, some of the most innovative products and services have come from employee ideas. So I think that consistent feedback and showing that you're taking employee feedback seriously and they're actually doing something with it, and you just repeat. I would say that's probably my favorite.
Yeah, so listening to the employees has been a theme for both of you, and also if things aren't done holistically, then you're also going to continue to have these issues. And the comment that I made early on about 10 years behind is it's now going so rapidly that if you're 10 years behind now and you don't start to have these conversations the right way, you continue to have an attrition problem. You continue to have siloed, work being done by groups that aren't holistic. You're going to be 12 years behind at the end of the next year, and it's going to accelerate and snowball on you. So, Patty, I know from my experience that, and one of the questions is, what have you seen healthcare practices doing to go from kind of like now to what's next, and maybe catch up with that 10-year behind the times thing as most efficiently and effectively as possible?
Yeah, I think, the ability to sort of go from, a lot of these organizations have on-prem contact centers. The ability to go to the cloud is huge, because they can then, meet their employees where they are. They don't have to have them in an office. There's a lot of different opportunities there. That's big. I think integration into the EHR so that they can, bring into perspective, understanding who the patients are when they call, being able to pop up that record so that they can understand, their journey. Adding additional omni-channel capability is huge for these organizations, and being able to have live chat is a big game changer. And some of those virtual agents, those are easy things to be able to do with cancel, confirm appointments, pay your bill, reset your password for your portal. That's a right. I mean, how many people call in because they can't get onto the digital front door. So now your contact center is being overwhelmed with people calling just to reset passwords. So there's a lot of different things that you can do that can really help you guys with modernizing the contact center and adding some of these things. That call summarization piece that I showed, that's available today. So that's a really great game changer for some of these organizations to get the information, appropriately on the phone calls, understand the journeys, and really help those agents save time and be more accurate, and allow them to really lean into the conversation versus taking notes.
Yeah, and I had some surgery last year, and I was very frustrated with voicemail tag.
Yeah.
And
exactly.
I couldn't just get a link to an SMS and schedule it, and then they give me surveys. I don't like surveys. You're gonna know how
Healthcare
happy
loves
I am.
surveys.
So what I would say is that I talk to a lot of people in the industry, and they still have in their head that the first thing that they need to do for better patient interaction platforms is to replace their current phone system. Not only getting the technology of a phone system, it's just phone systems were for voice communications.
Right.
Then they evolved into unified communications with other methods of communications. But the real benefit is voice streams that they currently have with an on-prem phone system can link into a cloud patient interaction platform immediately or faster, because we all knew that had to occur back when COVID hit. Right, people were stuck with phone systems, and they went in the direction of the cloud to integrate with Microsoft Teams and Google and all those different platforms. So again, when you start this employee-driven conversation, don't let the conversation be held up by this big wall called the way they've always done it. And that's what I hear more and more. So be open-minded to how can they get the big gain in the next year, 2 years or 3 years towards, being caught up. If they're waiting for the phone system to be replaced, they're going to be 15 years behind in a year or two. So,
well, and I think, Kevin, the other thing on that is, and I see this a lot, and that is just trying to get to, when they're replacing all of this, is just go to parity, right? Let me just stand up exactly what I have, but I'm going to put it in the cloud. They're very different systems. So it's very important, as you're just planning to go out and look at vendors, is to really think about what you want that to look like at the end of the day, and what are the things that you can do right away in the initial go lives in order to get you plus, right? You want to add new functionalities. People have a lot of change fatigue. So if you just think parity is going to be where you go, and then you'll incrementally sort of add these new things on, that's a mistake. Those people will just, first of all, no one likes change. So it'll be painful regardless. You think you're just doing parity, but like I can tell you guys, we've all gone through it. If you do an upgrade to Windows, right, and they move something, you're going to be mad. It doesn't
Right.
matter. So give me something that I get for it, right? I get all this new cool thing. So I'm going to be okay with whatever they moved the button to do. That's so important, is to give them something they can grab onto and say, well, it's not as intuitive as what I've always used, but look at all the new stuff I get. That is so, so, so important to look at. And I see so many organizations make the mistake of, let me just stand up what I already have. And it's becomes a really big problem.
I agree. And I think that's the last questions. And I want to close by saying that it all goes back to listening to those frontline employees, because of what they have today, and that they're trying to line up what they have today with something that can solve the problems in the future. That right there is the reason not to do it that way, right? Is because you're going to see what their vision is from a frontline worker perspective or from a patient interaction perspective. And it's not, and I think that's one of the biggest things for IT leaders that we do really need, but I think operations people need to be driving this more so, is that they don't have the cloud skills. They have software people, they have voice engineers and whatever. This whole thing is becoming software engineering, software developer driven, with people that have strong business analyst skills to say, you know, this is the work being done and this is how we can make it better, right? And to improve those two metrics, employee experience and patient experience. So again, the two of you, thank you very much for all your time preparing for this,
Thank you.
all your expertise and insights shared on this call, and hopefully we can have some healthcare providers get with Aimee, and we can have some deeper conversations. Thank you, everybody.
Thanks all.
Thanks.